My name is Stephen J. Sear, MD. Everybody knows somebody with a spine problem. Everybody knows somebody who's had a spine surgery, and many of those unsuccessful. And so a lot of times people come here desperate for help, but concerned that they're not going to get it, that there's no one willing to listen, that there's no one who's going to do a good job even if they do something. And so I try to put their mind at ease because I literally am here to serve them and to do everything I can.
I could not step sideways, take a step back. I was falling a lot. I could not keep my balance. And of course there was always the pain.
Before I had my surgery here at work, being able to walk back and forth became a challenge for me because I was starting not to feel my left leg.
My quality of life was I was able to do some of my daily activities, but they were very, very limited. The quality of life after doing my activities went down.
I've been dealing with this for about 20 years. As time progressed, I started to stop doing the things that I enjoyed. I like to play soccer. I stopped playing soccer. All of these things in an attempt to not have to deal with the root of the problem, which were the herniated discs.
It seemed as if, no one really cared. And that's why, of course, I came here, and it was totally different. I mean, they cared that I was in pain.
I had a C3 to T1 cervical fusion posterior. I'm a patient of his, and so I'm like, not only do I work here, but I'm also a patient. Now, after the surgery, I'm able to do everything. I came to work 10 weeks after I had my surgery. I can run, I can walk, for miles with my children and go to the zoo and do things like that.
After the surgery, it was just almost immediate relief. I was able to stand and walk the second day. His staff made all the arrangements, and I had all the equipment that I needed for a quick recovery.
And here I am, I'm able to do and go and play with my grandbabies. And
since that time, I've gotten full mobility back, starting to lose weight, lost about 35 pounds.
My quality of life is 100% better.
I'm able to have a great life all because of somebody cared.
And I hope if anyone is suffering for any type of debilitating pain, to please don't wait a second longer.
There's a ripple effect to pain, and a lot of people don't realize that. It's not just the patient you're treating, it's everyone in their circle. Everybody who has ever come into contact with them, everybody on the road, everybody who lives with them, everybody who works with them. So when you can fix that, when you can stop that cycle of pain, and you can take somebody who's debilitated and who's broken, and you can make that flip 180 degrees, that's the ultimate reward.